Hello, Dr. Caroline Lohrisch. It's such a pleasure and an honor to have you with us. Can you tell me a little bit about what you do?
So I'm an oncologist, medical oncologist at BC Cancer, and we partner with the BC Cancer Foundation to research all areas of cancer. We have a big area in breast cancer in particular, which is the area that I work in.
Earlier in your career, you got to work in the team that wrote the protocol for Herceptin. I personally had used Herceptin, so I benefited from it. So I have to say thank you. When I think of the fact that you were part of this team working on it, I think it's pretty amazing. And it brings me to what you do today. So tell me about the research that you have been able to do in the past few years and that you're still doing now.
So my focus in the last few years is actually about trying to identify which patients with low-risk breast cancer might be able to receive less treatment. In the pursuit of cure, we overtreat many women who have low-risk disease because we don't want to risk their cancer coming back. But now we have these modern tools that we can test tumors and identify patients who maybe don't need 5 years of treatment, maybe 2 years is enough. And you can imagine if you're taking a medication every day for 5 years that has side effects that affect your quality of life. This sort of area of research is called treatment de-escalation, and it's quite topical and quite of interest in the oncology community.
The C word is always, of course, full of fear when you hear it, even though we hear also such good news about how treatment have evolved. What would you say to women of what you're seeing and how things are advancing?
In Canada, we cure over 90% of breast cancers, and I think that's a message that doesn't get out there enough, quite honestly. There are so many women walking past you every day who had breast cancer and have put it behind them. And I think that's really the most important message that needs more airtime.
Definitely.
Yeah.
Well, I thanked you before personally because of the Herceptin work that you have done, but I want to thank you again because when I hear you talk about what's coming up, I feel it's just so much hope. And I do hope that this message that you just said will have more airtime. And thank you so much for sharing with us.
My great pleasure. Thank you for having me.